Hello everyone, and welcome again to our webinar today on measuring commercial sexual exploitation of girls in Dhaka, Bangladesh. It is great to have many people attending today. Before I introduce myself, I just wanted to let everybody know that there is an interpretation available in Bengali language today. Kindly click on the globe at the bottom of your screen and choose English or Bangla. Or if you can't find the globe icon in the bottom of your screen, kindly click on the three dots and see if you can find the globe icon there. Please note that this webinar will be recorded today. Also, we have set aside for discussion towards the end of the webinar. So kindly submit your questions via question and answer button in the bottom of your screen. Now it is my turn to introduce myself. My name is Khalida Akhtar and I am here at the Freedom Fund and I work on a program based in Bangladesh to address commercial sexual exploitation of children in Bangladesh. So let me share very brief about the situation and context of Bangladesh. So commercial sexual exploitation of children, and in short we call CSEC, in Bangladesh is widely recognized as a significant problem driven by factors like poverty, cultural norms, exclusion of education, migration, criminal enterprise, and climate change. Globally, the lack of robust data on this issue has made it difficult for formulate effective policies and intervention. In Dhaka, the capital of Bangladesh, CSEC is prevalent in brothels, red light zones, hotel, private residence, slum and street, where children face high levels of violence and coercion. Many children of brothel workers often enter the same trade, perpetuating a cycle of exploitation. Child survivors of commercial sexual exploitation face ongoing hardship, including living on the street due to trafficking and poverty and attempting escape of abusive family members. Despite the severity of the issue, rigorous evidence on the extent and scale of CSEC in Bangladesh is scarce. So support evidence-based response, Population Council in Bangladesh and the Freedom Fund conduct a large scale of a study to measure the scales and nature of CSEC in Dhaka, Bangladesh. The survey involved 1,245 young female sex workers in street setting in the Dhaka district as well as brothel in the Dhaka division. Let me share the objective of the webinar. We will start the webinar with a presentation from Population Council on some of the key findings on CSEC in Dhaka, Bangladesh, based on the study. After that, we will have Wahida Banu from Aparejeyo Bangladesh, a national human rights NGO, also will share insight on the realities faced by the girls involved in CSEC and identify critical gaps in policy, program, as well as suggest some long-term solutions. At the end, already I have shared, we will have a question and answer session. With that, I would now like to introduce our first two speakers from the Population Council Bangladesh office. Our first speaker from Population Council is Sigma Ainul, is a senior program officer at the Population Council with 15 years of experience leading research, developing program, and providing technical support of vulnerable populations. She specializes in sexual and reproductive health, gender equity, preventing gender-based violence, and modern slavery. Sigma has authored numerous research papers, holds a master's degree in population science from the University of Dhaka. The second speaker from the Population Council Bangladesh office, MD Irfan Hussain. He is a statistician and a social researcher, spent 13 years of the Population Council in Bangladesh, providing technical support for research, survey planning, data management. She has authored various research papers taught public health and statistics. He holds degree in statistics and MBA, and now currently he is working in UNICEF as a national consultant. So now I am handing over to Population Council speakers for their presentation. Thank you, everybody.
Sigma, you are muted.
Thank you, Khalidappa. Now I'm going to present some of the key findings from our study on commercial sexual exploitation of girl children in Dhaka and selected brothels. Next slide, please. What we hear from Khalidappa's opening remark that there is a gap in understanding and recognition of CSEC in Bangladesh. Also, there is data and evidence gap. The objective of our study was to examine the phenomena of CSEC, its types in context of Bangladesh, and different forms of violence and exploitation that is attached to it. Our second objective was to provide a size estimation and prevalence of CSEC. The operational definition that we used in our study is commercial sexual exploitation of children is the sexual exploitation by an adult to a child or an adolescent under age 18, accompanied by a payment in money or in kind to the child or the adolescent or to one or more third parties. Next slide. Next slide. So we followed a mixed method design and it has two parts. First, we did a formative research. We conducted 25 key informed interviews with stakeholders, including topic experts or who work directly with the population, and also with CSEC survivors. They were from international and national NGOs, civil society organizations, development and implementing partners, activist groups, and networks. In the second phase, we conducted the behavioral and size estimation survey, which was a cross-sectional survey with female sex workers. Formative research helped us in identifying the hotspot where we conduct the survey, particularly in Dhaka and with street-based sex workers. And it also helped us in guiding the design of the study tools and also the methodologies for accessing this population. The research protocol were reviewed and approved by Population Council Institutional Review Board and also from Bangladesh Medical Research Council. The survey population was female sex workers aged between 18 to 22 years old. The survey we conducted was retrospective. Respondents answered questions thinking about their past time when they were minor, that is below age 18, and they shared the related experience of CSEC. Survey was conducted in street-based sex workers in Dhaka city and also in 3 brothels in Rajbari, Dowlatia Rajbari, and 2 brothels in Farikpur, that is Rotkola and Sinbighat. Next. Moving on to the results. Next, please. This slide shows the distribution of age and educational attainment of the surveyed respondents. The graph on the left shows the distribution of age. The light blue bar denotes street-based sample, and the dark blue denotes the brothel sample, and this style will be maintained throughout the presentation. So age is distributed across age range from 18 to 22. More samples were from the 20 to 22 age group. The average age of the respondent was 20.6. If we focus on the graph on the right side, we see more than 1/3 of our respondents have no education. The percentage of no education is slightly higher in brothel-based sample compared to street. 1/3 of the respondents come as primary incomplete in their education attainment. That is, they have below grade 5 education. 31% in the street-based and 29% in the brothel sample. Then we see some smaller percentage in primary complete and secondary incomplete categories. Next slide. A large percentage of our survey respondents were migrants, 75%. And most commonly cited reason for migration was poverty, 77% said so. 28% reported of family migration, another 20% reported of deception, 10% escaped from home, and around 6% migrated due to violence. If we further look in between the samples of the street-based and brothel-based, we see percentage of deception is much higher in brothel-based sample, around 31%. On the other hand, percentage of family migration is higher among the street-based sample, around 38%. Next slide. So from where do they migrate? This table in the top shows the distribution among the street-based sample districts from where they migrated to Dhaka. Highest percentage came from Borishal, which is a district in South Belt of Bangladesh, which is also vulnerable to multiple climate-related events. The other districts in top 5 were from where they migrated are districts just nearby Dhaka and have good communication with Dhaka. We can see similar pattern in brothel-based samples, that is the bottom of the table. Top districts respondents were migrated from Dhaka. Here, in the brothel, the destination is the Faridpur and Rajbari, and they migrated from Dhaka, Mymensingh, and nearby districts, which are easily communicated, good communication with the districts, and also from the Borishal being the top again, which is climate vulnerable. Next slide. In the survey, we have also found that large percentage of respondents have experienced CSEC, 75%, and slightly higher in the brothel, 78% in brothel and 74.5% in street-based sample. The top thing they received in return was food, that is 91%, with a slight variation in brothel and street. In brothel, they mentioned 99% mentioned they received money and 87% mentioned in street-based sample. Food and gift were received by 12% and 13% of respondents respectively. If we further focus separately on street-based and brothel-based percentages, we found that the percentage of receiving food and gifts were higher among street-based respondent compared to brothel-based respondent. Next. We asked the reasons they exchanged sex for the first time while minor. 80% stated that they needed money to survive. 27% said to earn money quickly. Force through physical violence was reported by 27%. Another 25% reported being coerced or manipulated. 15% reported they needed money for emergency. If we further look into the distribution, we find that violence, coercion, emergency, manipulation percentage was reported higher by the brothel-based female sex workers compared to street-based. On the other hand, percentage for needed money for emergency was higher in street-based compared to brothel setting. Next. We asked about the perception of consequences she might have faced if she refused sex for the first time. About 54% in the street-based sample said there would have been consequences, and it was 62 in brothel-based sample. Among the consequences, physical violence, sexual violence, deprivation of basic needs such as food, water, place for sleep, emotional violence and abuse were among the major thing the respondent mentioned that they perceived this would be the consequences. If we see the bars represented in the light blue versus dark blue, that's street and the brothel-based sample, if we compare, in every category, you can see that the perception of percentage of negative consequences were reported much higher among the brothel-based female sex workers compared to street-based sex workers. Next, please. At this point, I would like my colleague, Mohammad Irfan Hossain, to carry on the rest of the slides.
Thank you, everyone, and thank you, Sigma, for giving me the opportunity to talk. So over here, we are seeing the profile of the perpetrators as reported by the CSEC survivors. So if we see that in the overall and the subsample of the street-based female sex workers, they reported their clients or the perpetrators, their age range is from 20 to 42-ish. But there is a little bigger range for the brothel-based CSEC survivors. They said their clients' age range from 19 to 45. So this can be more understandable if you see the lower portion of the table. The profession of the perpetrators are given here, and regardless of their types, like whether the C-sex survivors are from the street-based or brothel-based or the overall, we see a big chunk of these clients, profession is they are engaged with any sort of business. But if you see the last line from the below, there is a students are the primary chunk of clients for the brothel-based reported by the brothel-based C-sex survivors. So that's why the age range is little bit lower for the brothel-based female sex workers. And the other primary profession that were reported by the C-sex survivors that their clients are from mostly engaged with transport. They can be transport worker or they can be drivers. And rickshaw puller and CNG drivers are also reported by these C-sex survivors that their clients are from those professions. Next slide, please. So in this table, we summarized the average number of perpetrators they experienced while they were minor, and how much money they get in an average from each client. So if you see, the street-based C-sex survivors reported less than the brothel-based C-sex survivors, while they reported their average number of engagement throughout the week. And also the average number of clients also varied between the two types of C-sex survivors. Brothel-based C-sex survivors reported more to serve more number of clients to serve within a week, which is 44 compared to the street-based C-sex survivors reported almost 17. But regardless of the engagement and the number of clients, the average fee that they receive in return from the perpetrators is quite similar, and it's almost 400 in Bangladeshi taka, almost 420 taka, which is equivalent to 3.5 US dollars and 2.6 British pound. Um, but the money they received, they have to almost both types of street-based and brothel-based C-sex survivors. They said, yes, we have to share with other parties. It can be facilitator or my family members. So 3 out of 4 brothel-based C-sex survivors said, yes, we have to share the money, while this proportion is lower in the street-based C-sex survivors, which is almost half. Next slide, please. So, sorry, this slide has so many rows, but here we try to show you their experience on the female C-sex survivors' experience while they were minor, whether they faced any type of physical or sexual violence, coercion, or control. So we see that overall, 6 out of 10 of them reported they have experienced so, and we further dig down into one section. You see there is a physical and sexual violence portion. So almost 50% of them said, yes, we experience any sort of physical and sexual violence. If I would further dig down, like I like to quote one activity like slapping, punching, kicking. Almost throughout the street different type of C-sex survivors, they reported similar percentage, 4 out of 10, they experienced this sort of physical violence. And 1/3 of them, they said they were engaged in sexual acts they were not agreed upon. In terms of control and coercion, we are seeing that who are from the brothel-based part, they experience more percentage about being controlled, like they haven't had the opportunity to move around freely, or they were on a threat to be reported to the local police authority. Their money has been snatched away. They didn't have access to their earned money. So these are more found to be prevailed among the brothel-based counterpart than the street-based C-sex survivors. Next slide, please. In this slide, we are presenting their reporting about their alcohol and substance use. So while they were minor and engaged in CSEC, so this is quite more report we got from the street-based CSEC survivors than the brothel-based one in the context of alcohol. But in the context, while we ask them whether they consume the alcohol regular basis, then it becomes more prevalent in the brothel-based CSEC survivors. And their average age of initiation of the first time they use alcohol and drug is roam around 15 to 16 years. And we further asked them why did they consume the alcohol or take the drugs. So these three reasons, like forgetting their life sufferings and to think good about themselves and to cope with multiple clients. So these three reasons came up both for the alcohol and for the drugs, and this is a multiple response questions. There were some other categories, and for the sake of presentations, we are not going to present it over here. But if you see for the alcohol, almost 50% of those who ever consumed alcohol during their minor life while they were exchanging sex, they said they used it for those three reasons. Next slide, please. We also asked them, do they have any kind of access to the different support services available? And if you see on the left side, this is street-based portion. On the right side is brothel-based, but the bars is quite different from what we have seen earlier. The light blue bars are representing whether they sought help to the respective uh, providers or leaders, that is in the horizontal axis, and the dark blue bars represented those who sought whether they found it helpful or not. Like first is the whether they sought it or not, and they received the help or not. So we are seeing there is a very variety of service providers or personnel on the street base because they have the mobility and they have access to different type of service holders like the NGO workers, health workers. Health workers means the doctors, the nurses, the community health workers, the elected officials, the facilitator, community leader. But on the right side, we are seeing the brothel-based female sex workers who experienced CSEC at the time of while they were minor. So they had just quite a number of professionals only: the NGO worker, the health professionals, women group leader, and the community leader. So if you so in general they like this is a multiple response question. So if we summarize from the street base, one third we found one third sought any type of help from the professionals, and mostly the NGO workers is prevailing in both the street base and the brothel base C6 side. So C6 survivor side. Next slide, please. So in this slide, another objective, as Sigma mentioned earlier, another objective of this survey was to find a plausible number that can be prevailed in Dhaka district and the three selected brothels. So what should be the number of the total number? So this is a survey, so we can get a guess, and we use the statistics provided by the national agencies like the Bangladesh Bureau of Statistics and National AIDS and Study Program. So using their findings during the time 2016, they made the National AIDS and STD program. They made a comprehensive report about the number of different type of female sex workers for overall. It was a national report. So using that base, we extracted the 18 to 22 years old female sex workers number from that report, and because that was produced in 2016, so we have to project it for 2022. But here is a thing that because the settings is different, we have street based in the Dhaka district and uh, three selected brothels that are in the Dhaka division. So the growth rate cannot be the similar. That is our understanding. So we use the national growth rate that we found in the National Census 2022 by the Bangladesh Bureau of Statistics. So we use that growth rate for the street-based female sex workers when we projected it for the 2022. And for the brothel based, for the brothel based, we use that national growth rate. But as Dhaka is a very concentrated area, Dhaka district and also the Dhaka metropolitan is a very concentrated area, so we cannot use the national growth rate over here. So for this reason, we look for more realistic growth rate, and we use the Dhaka North City Corporation's waste management report, and over there they highlighted it. It can be 3.75. So using these different proportions, we came up that almost 22,000 can be street-based female sex workers in Dhaka district, and for brothel based it can be 3,200. And using our calculation, we found that almost 5,000 can be the CSEC cases of among these 22,000. Almost 5,000 can be CSEC cases in street-based portion, and in the brothel base it can be around 700. And using these two numbers, we found the prevalence to be almost 22%. It can be ballpark around 22%. Next slide, please. So in conclusion, we are seeing that already Sigma mentioned like 75% of these female sex workers, they provided us insights that they were involved in um, exchanging sex while they were minors. But when we dig down more, the first age when they experience this type of incident, we found there is a quite variation among the street-based and the brothel-based. So 36% in the brothel-based, C6 survivors said they were engaged with this type of activities before the age 14 or maybe younger. And we seen that when they migrate, the major factor for migration is a poor poverty. So they are from poor socioeconomic background, as Sigma mentioned. Most of these have low exposure to education. Almost 60% of them have not completed primary education. Deception found to be one of the main reasons, and Sigma specifically mentioned in the brothel-based C6 survivors, they said more that because of the deception, they came to for the migration part. And rates of coercion and control, I already discussed about this, and so we need to think about this future. And many survivors recall that alcohol and drugs, they used it to, cope up with their situation. Next slide, please. So in a summary, I'll make it short. So based on the discussion, we found that we have to work at the source level. So for this, we have to think about the counter trafficking committee, child welfare boards, and community-based child protection committees has to work in hand so that these things can be solved, rectified at the source level. And the policymakers or the who work with the law, they have to sit down with the C6 survivors and the civil service organizations to ensure the laws are properly, at the place, and it is to ensuring the survivors get the uh, mm, rehabilitation and integration support. And the C6 survivors and the community civil service organization can definitely collaborate with the statutory body so that the norms that we have for the C6 survivors, we more empathetic with them, and we can provide them more support. And here we have to work that all the stakeholders like the donors, government bodies, civil service, civil societies, they can all work together to, because we found a very large proportion of them are using alcohol and substance use. So there can be some steps to mitigate it. And also the prevailing services, social services for them, we have to provide it more focus for these vulnerable groups. So next slide, please. I think this is the end of our presentation. Thank you.
Adab Shobaiki. Hello, everyone. My name is Michelle Mendonça. and I work with the Freedom Fund supporting our team in Bangladesh. I'd like to start off by thanking Sigma Appa and Irfan Bhai for sharing the most important findings from the study. And now we'd like to move from research to on-the-ground realities. I have the honor of introducing someone who most of you know. Wahida Banu is a dedicated social development and human rights activist, particularly focused on the rights of children and women. As the executive director and founder of Aparejeyo Bangladesh, established in 1995, she has overseen initiatives supporting disadvantaged children, destitute working mothers, and over 10 million community members. Wahida Appa is the author of several books and publications and is a prominent researcher in Bangladesh. Welcome, Wahida Appa, and over to you so we understand more about the realities of CSEC in Bangladesh.
Appa, you are muted.
Thank you, Michelle. And good afternoon, everybody. This is Wahida Banu, the founder and the executive director of Aparejeyo Bangladesh. For over 2 decades, Aparejeyo has been at the forefront of the protecting and empowering vulnerable children in Bangladesh with a particular focus on addressing CSEC, the commercial sexual exploitation of the children. Today, I'm going to speak about the critical and the complex issues of CSEC and the challenges that my organization faces on the ground and the long-term solutions needed to address this crisis. So I would request for change the slide. The situation of the CSEC in Bangladesh. The commercial sexual exploitation of the children is an urgent issue, especially the areas where Aparejeyo Bangladesh operates. The girls are forced to sex work at an alarming young age, and those who resist are subjected to severe form of abuse, physical, psychological, and sexual. In brothels, the girls are often referred as supri, are in high demand. They're under the control of pimps and madams with no opportunity to express their needs to coercion. Many are even injected with hormones to accelerate their physical growth so that they can be exploited very sooner. Their income is controlled by those powerful pimps and the shardanis, leaving them no bondage and for years, and they are trying to repay the money they owe to their madams. And these girls have no to say in their lives because their basic needs, food, shelter, clothing, whatever, are provided in exchange of their freedom. On the streets, the situation of the girls is equally dire. The girls are frequently abused and exploited in the locations of abandoned buildings, parks, bus terminal, even in the graveyards. They live without access to healthcare service, shelter, regular meals, and the basic hygiene. Many of these girls are controlled by the gangs and the formal sex workers who now act as a madam. This cycle of abuse and exploitation is both devastating, extensive, and affecting thousands of children. Next slide, please. The key interventions, as Aparejeyo Bangladesh has been actively working on to combat CSEC, through a very serious and series of very comprehensive interventions. First, we have ensured that the staff members are thoroughly trained to understand the vulnerabilities of the children. This training allows the staff member to establish the rapport with the victims at the hotspots, on the brothels, on the streets. From there, they can facilitate to rescue the girls to our shelter home immediately. And if it is not, then they can provide the information to the girls so that they can have the services from elsewhere, wherever they are located. In our safe shelter, we operate an open door policy and a range of services aimed at the rehabilitation, empowerment, Regular motivational and awareness sessions also helps the girls to understand the danger and of their current situation whatsoever. It's early pregnancy, drug use, HIV/AIDS, STI, and even we encourage them that what are the alternatives. That is, could be the education and the vocational training. We arrange also group activities like games, music, singing, dancing, playing, excursions, picnics, so that they can feel sort of like bondage with their peers, and they can have a skills of the decision-making process, and all while they are participating in a joint management committee. Normally what we say, the joint management committee in the shelter home, we have got children and the staff members together, they consist the formation of the joint management committee. And in addition to that, life skills training session along with the HR is also provided, and to give them the understanding of trafficking, equip them with the children, they have the tools they need it for their future. Aparejeyo also offer education, vocational training, counseling, social rehabilitation program, and family reintegration is the most key component. As the organization works to bring the children back to their home, when we feel it is a very safe situation and it is possible. This is a very holistic approach, and we reinforce by a regular follow-up. It is minimum 6 months, maximum 2 years that can be extended. And we should ensure that the girls are supported through their recovery and reintegration into the society. The next slide, please. But without, the comprehensive support, it cannot be possible to carry forward the support to the CSEC children. But despite these efforts, systemic barriers continue to hinder the complete eradication of the CSEC. A pervasive issue is the discriminatory behavior directed towards the girls. Gender discrimination, class discrimination, cultural discriminations remain entrenched, and harmful societal attitude portraying girls as less vulnerable to reinforcing the stigma around their experiences. These societal changes are compounded by the legal and political landscape. Many laws are outdated, tracing back to the colonial era, and even when we have new laws are introduced, their implementation is inconsistent and insufficient. Policymakers and the institutions often lack of knowledge and will to enforce these laws, while traditional attitude continue to perpetuate gender-based violence and exploitation. Family poverty is another significant barrier. Many families unable to provide for their children, and they see what could be the alternatives. But to allow their daughters to fall into this dangerous situation, and without systemic change and poverty alleviation, this cycle is likely to continue. Please, next. So, what would be the long-term solutions? To address CSEC in a meaningful and long-lasting way, we must first foster the political commitment at the highest level. This requires more than lip service. It means allocating an adequate budget for the girl child, improving the capacity of the institutions to enforce laws, and ensuring the policymakers to take a more active role in implementing national plans. Education is another critical factor. By reforming curriculums to portray girls positively and without bias, we can begin to change societal attitude over time. Educating parents to raise their education at the level so that they understand their boys and the girls should be, grooming without discrimination. It is very crucial to breaking this cycle of exploitation. Next, please. Next slide. Okay. So this is another most important part which I truly feel and mean that media can play a very essential role in changing narratives around the girls and their values. If used effectively, it can create positive messages that uplift the girls and educate the public about the danger and horror of the system. Ultimately, a national effort is needed, one that involves local leaders, parents, community people, institutions, academicians, researchers, policymakers together. We can create a proactive and safer world for the girls in Bangladesh and beyond. While the scale of the problem is very vast, we cannot lose hope. Aparejeyo Bangladesh work has demonstrated that the change is possible. There is a hope. The girls can be rescued, rehabilitated, and can be given the tools they need to rebuild their lives. But truly to eradicate CSEC, we must come together to address the systemic barriers, invest in education, and foster political commitment to protect the most vulnerable girls in our country and beyond. So this is my last slide. Thank you very much for your attention. Thank you, Michelle. And I'll pass the floor on over to Michelle now. Thank you.
Thank you, Wahida Appa. Insightful and action-oriented as always. We would now like to invite audience members to submit questions to the panelists. If you would like, please submit questions via the Q&A function on the webinar. While you're typing in questions, I'll start us off. My first question is to the Population Council researchers. What were some of the methodological challenges that you faced when accessing the research participants? Since you directly spoke with female sex workers in both brothel and street settings, how did you overcome these methodological challenges?
I might take this question. Yeah, as this population is very vulnerable, we face challenges in terms of access. Access was the biggest challenge, how to access this population, and also to establish trust among this population so that they share their experiences with the researchers. So for this, we collaborated with our implementing partners who are working at the grassroots level. We also included them in when we designed the study tools in their training, our data collectors, so that they can input on how to approach this population. They also work through the terms they could use and other possibilities where we can improve. So in the street-based sample, we worked with the sexual workers network, and 10 outreach workers were with us throughout the time of the data collection team, and they helped us in accessing the population. So I mentioned that there are some hotspots that we identified, and where we did the survey, there were 20 hotspots in Dhaka city. And for each of the hotspot, one of the outreach workers were assigned from sex worker networks, and with those outreach workers, our data collectors work. So they identified one seed or one respondent from each of the hotspot first, one female sex worker whom we can interview. And subsequently from that sex workers, she directed us to 3 other seeds in this hotspot and so on. So the other second layer of seed also directed us to 3 more respondents. So that's how we conducted the survey in the street based in Dhaka. And with the help of the outreach worker, it was also easy to build the trust and also to consider the safety situations for both for the respondents and the interviewers. Similarly, when we worked in the brothel setting, we worked for implementing partners, KKS, Kormojীবী Kolyan Sangshthan, Shapla, Mahila Samiti. They were with us. So their outreach worker helped us to In the brothel based, we use the sampling framework was provided by the implementing partners, and also our outreach for our data collectors work to refine the list. So we sample everyone in those 3 brothels, and they are also the outreach workers help us with the access in building the trust with the female sex workers. So this is the way we did this, overcome these challenges and continue with the data collection.
Thanks, Sigmapa. My next question is to Wahida Banu. In your experience, what would you recommend as the most impactful areas for donors to invest in to address the issue of child sexual exploitation and abuse in Bangladesh? How can donors ensure that their contributions lead to sustainable long-term change? Wahidappa?
Yeah, thank you, Michelle, again. I think the way we work in the field, I feel that to address and impactful, impact on the CSEC issues, that would be contribution by the donors. I feel that a consortium can be formed with the 2-3 organizations. They can monitor the field thoroughly, and they know the data collections, they know the monitoring, they can oversight the newspapers and the radio television program, and they can meet the press. At the same time, there is a plan of action which is done by the government. We have to push a bit how the government has been progressing. Side by side, lobbying and advocacy, policy advocacy is very important. The consortium can reach at the national level to grassroots level to see the situation on that. And the other issue is, I think that we need to know very in depth and very carefully about the concept and the understanding, identification issues about the survivors and the victim of the CSEC. Because if we don't have a very clear understanding, then we cannot provide them as per their need and the demand, the intervention won't be matching with them. So at the field level, I would like to have a sort of like information hub, and that hub can, disseminate the information, giving the materials, giving the directions, and support to the survivors or the victims or the girls who are at risk. They can go there and they can get the informations. There are so many service providers. So we have to be very open and open up our door so that they can get that support from there. And they should also get to know that if they are stuck, in which place they will go and complain. Is the police station is our last resort? Is the shelter home is our last resort? Or home is our last resort? So we have to have our clear understanding about this. And the donors' contribution is a very important issue, Michelle, because what I feel that in the country over 50 years, the NGOs and INGOs are working in the field. I think that many of the times there are organizations, the actors in the field, when we have, resources and the money, we truly work in the field. We are our existence and we are vibrant in the field, but when we don't have resource or funding, we don't work much in the field. There are very few number of the actors. They exist when they don't have donors. So my suggestions would be the donor or the development partners could identify the very, authentic actors who have a very clear understanding, who have an organizational history, capacity, who have a record of accomplishment of many projects. They can be engaged for this work. They can coordinate with the SDG Goal Coordination Committee and the ministries that are working, implementing national action plans. So if they work very closely with the government, then they can also support the organization who have the capacity and whom they can be engaged in the same platform or the same areas. Like there are organizations, there are academicians, researchers, there are professional groups. They can be together to support the CSEC victims and their, victim or the survivor both. But at the last, my comments and the suggestions would be the organization should have a capacity or a very clear understanding about the sustainability. Because when we write the project proposal, many of the times I talk it very straightforward in any platform, that when we write the sustainability, we write many things. This is the way things will be sustainable. But at the end of the day, nothing is be sustainable, we have seen. So that would be my main focus. The actors can have a very strong role and the responsibility to bring those people and the actors together so that they can raise the local resources. They can mobilize the local resources, funding, and the local level contribution from the individuals, from the institution, from the corporation, social responsibility, from the social safety net, and create access to the local resources means that they will have money even after the project will be phased out. So if we don't have that mechanism is being established in the country, we cannot continue and support our children and the girls who are at the very vicious cycle, and they cannot get out from this cycle. So these are the suggestions I'm placing here. Michelle, over to you.
Thank you, Wahida Appa. We'll now go on to some audience questions. The first audience question is to Pop Council. The audience member says, "Hi team, congratulations on the study. Can you clarify the nature of street-based sex further?" Two follow-up questions. Why do you think the population of street-based sex is high? How do the criminal enterprises differ in managing street-based enterprises in comparison to brothel enterprises? This is a question for Population Council.
Hi, I think I can take that. So I already answered it in the question and answer, portion, but I'll say it again. So the specific question was why the population in the street base is higher than the brothel base. So the NASP study, the National AIDS STD Program study, it was very comprehensively done back in 2016 with the collaboration with the National Statistical Office, that is Bangladesh Bureau of Statistics, and ICDDRB, and some other local experts. So that was a very rigorous study, and where the estimate of the female sex workers in each the district, we had the administrative area of Bangladesh, the region, the divisions. So those type of classifications were provided for the different type of female sex workers. So they found more female sex workers are in the free conditions, like roaming the street, or maybe providing their this type of works in street, or maybe in hotels or residential. But another portion, the brothel part, is there are only 11 brothel functional in Bangladesh, and maybe 5 to 6 in Dhaka division. And from there, we only selected, when we did the formative research, 3 brothels name came up where we did our study. So that's why the population of the brothel-based female sex worker is quite low than the street-based one. And Michelle, can you just say the another portion? Sorry, I got carried away. The another portion of the question was what?
Yes, so the second part of the question was, how do criminal enterprises differ in managing street-based enterprises in comparison to brothel enterprises?
I think I cannot recall from the formative study whether we have those type of like the involvement of the criminal activities, but we did have some information of the facilitators or the pimps or the mashis mashi means the aunties in the quote unquote aunties, they say the pimps in the brothels. We have their presence and their controlling and coercions type of information. We have those type of things, but not necessarily criminal rings are running the shows. Like, we have not came up this kind of findings from our surveys, but Sigma can shed some lights from the formative research. So far, I'm not aware of it. Sigma?
Partly, no, we didn't find that criminal ring or done that things that was came out in our formative as well. But the control and coercion was mostly by the PIMS, and also the law enforcement agencies were also involved, the police. Those things came out in the formative. And the control and coercion, they work hand by hand with the brothels, with the mashes. That is what we found. And in the street also, they mostly found there is no so-called beams or mashi, but for each of the spots, there is someone who takes control of the amount they could take, who can work in this area. Those controls also there in street-based, amongst street-based sex workers.
Thank you, Sigma Appa and Irfan Bhai. I'm afraid we have run out of time for questions, and we need to move on to the conclusion. As we near the end of our session, we'd like to pose one last question to the panelists. Looking back on our presentations and discussions today, what is the most important thing for stakeholders to keep in mind when addressing CSEC in Bangladesh? We would like to request each panelist to talk about one point and keep responses to below 1 minute, please. Thank you. We'll go first to Wahida Appa.
Sure. Thank you again, Michelle. Thank you, everybody. We were quite close at the closing part of the webinar. I think the most important part is the commitment level has to be raised at the political parties level, at the local representatives level, at the community level. But on the other hand, the parents or the children itself, they should have a very clear understanding and given the criteria that how they will, get rid of from the situation, away from the situation. They have to have the skills. The way we worked, we found out that there are many girls, they become established, they are educated, skilled, and they are rehabilitated. Now they are like a productive citizen. So this is something like it is possible. So we have to say zero tolerance to this suicide because this is not that visible in the country. Everybody knows, but as if nobody knows. The situation is more or less like denial factor we are carrying forward years after years. So my issue would be that how we can establish the zero tolerance to the younger girls, particularly who are on the streets and even in the brothels. And we have to establish a child-friendly Bangladesh, where the girls are safer and they are protected. And it is not only in Bangladesh, because from the Bangladesh, many of the children are trafficked in country and outside country. So we have to talk about this in country situation and when the children cross the borders. Thank you very much.
Thank you, Wahida Appa. And now over to the POP Council team.
I can go first. So for the CSEC, I think the prevention should be focused first because as they become survivors and victims, very hard due to the stigma, and the rehabilitation, reintegration is very costly and takes a long time and was very difficult because of the stigma. And for the reintegration, and we need to really assess the minimal threshold of support that is required to stabilize the survivor and then lead them to the alternative path of livelihood. So we need to assess that first so that we just do not touch and go, but actually invest in changing their lives. Thank you.
Thank you to the POP Council team, to all the speakers and panelists for your invaluable insights and expertise. Your contributions have shed light on the nature and scale of commercial sexual exploitation of girls in Bangladesh. On behalf of the Freedom Fund, we also want to express our gratitude to our audience for your active participation and thoughtful engagement throughout the session. The recording will be made available to those who could not join the webinar. And just as a reminder, the report is titled Through Her Eyes, Measuring Commercial Sexual Exploitation of Girls in Dhaka, Bangladesh. You will find the link to the report in the chat box, or you can also scan the QR code in the slide shown here. Thank you so much to everyone.